Welcome back to Cruise Control, and on today's show I have Dr. Amin from NMC, who has been filling us on the current developments of COVID-19. And now, just a while back we were discussing about social distancing, but I want to break that down. I want to understand as a layman what this is exactly. So Dr. Amin, just a question to break this down, okay? If I have, say, a couple of friends over at home, say a group of 3, would we be complying with social distancing in that case?
All right. Let me try to explain it as simply put it. Social distancing means you make a conscious effort to cut all interaction with anybody outside of your household. When I say household, I mean people who are living within the same home. This includes extended family, members living in other houses, relatives, and friends. Okay, so you need to be aware that the people who are not living in the same home are also included in the social distancing practice. So let's suppose social distancing does not comprise of a set of number, which is the truth. For example, you may think that by meeting in a group of 3 people, you are practicing social distancing, but this is against the principle. The reason is very simple. Now imagine somebody in one particular household has said, okay, I'll just go out with 3 people, and that's not a big group. Right. And another household, and soon enough we have 1,000 people lining the streets.
I agree.
Social distancing basically means you literally lock yourself down and go out only and if absolutely necessary.
Okay, so right, people also need to know that once they practice social distancing, I want to know, how does it help the community? Now, I know how it helps the community, but people out there might not know about it. So can you tell us that what does flattening the curve mean?
All right. That's a good question. Social distancing helps the community by reducing, if not preventing, the spread of the disease, directly I mean, and slows down the pace of thereby allowing the healthcare providers to attend to every case with full concentration and proper equipment. I want you to understand something. If a healthcare provider is flooded with an overwhelming number of cases because social distancing was not practiced, and they are filled to capacity in the hospital with all the beds, then all the other patients that need to take those particular places are not going to be able to get the treatment they need because all the beds have been occupied by the patients who have been diagnosed with COVID. If you actually practice social distancing, it'll decrease the number of cases popping up in the community of coronavirus.
In this, we are also including the suspected cases.
Yes, kind of. Yes, absolutely.
Yeah.
I would agree there that it also includes those people that are suspected. So overall number of people coming out positive or that need to be tested or have been tested positive, it will overall decrease. And therefore the hospitals will also have enough space to treat other patients that need their help as well. This is called flattening the curve, which means that there is not a sudden and an absolute rise of the cases one day when we wake up. If you notice around the world, it is always a very slow, gradual 4 or 5 cases here, 4 or 5 cases there. And suddenly there is an upward peak of 200, 300, 400 cases. These are nations that did not practice social distancing.
Right.
The nations that did practice it, the upward peak or the surge never came. And this is what the Ministry of Health Oman has been trying to do.